Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for this episode is Glaucoma Health Coaching, a survey of eye drop installation education. I'd like to thank our host, Gretchyn Bailey, our topical editor, Dr. Andrew Rixon, and our topical expert, Dr. Joe Sowka. And now it's my pleasure to begin today's podcast.
Hi, everyone. I am Gretchyn Bailey, and I am a fellow of the American Academy of Optometry, and I am joined by Joe Sowka, who is also a fellow of the Academy and optometric clinic provider at Center for Sight in Sarasota and Venice, Florida. Hi, Joe. Thanks so much for talking with me today.
Oh, I was glad to, Gretchen. Glad to be here and glad to be helping out.
Well, today we're going to be talking about a recent publication titled Glaucoma Health Coaching, a survey of eye drop installation education by Topical and colleagues in the May 2022 issue of Journal of Glaucoma. And this study assessed what proportion of glaucoma patients had received any education regarding eye drop usage and whether a health coaching intervention would be beneficial. What did the study results show?
Well, the results show that a lot of patients have not received enough information and very little drop installation. And I really like the study. It is beautiful in its simplicity. It was done during Glaucoma Awareness Week at Moorfields Hospital, and they set up a coaching session, a coaching station adjacent to the glaucoma service. And everybody who was there that week was either invited to participate or they volunteered, where they answered a few simple questions and they were given information about their disease. And they're actually given some health coaching, showing how to put drops in their own eyes. And I think that's one of the things that we are not doing properly. We know what to prescribe, how to prescribe it, when to prescribe it, but I think we take for granted everybody has the same facility using eye drops as we do. I mean, we've all used eye drops even as students, putting it in each other's eyes. But it's actually kind of hard for patients. And in the study, virtually half the patients who were at the clinic did not receive any health coaching about it. And of those patients that had gotten no help at all or installation instruction, the vast majority said it would have been very helpful to them. And the other half that did have education and drop installation demonstrated to them said more coaching and more information was also very helpful. And we're talking 90% in each group said the same thing, that this information is very helpful. So I think we sometimes take for granted by saying, take the drops, that everybody knows how to do it.
That's a really good point. And a big challenge in practice today is managing time spent with patients. So how can optometrists incorporate patient education in order to help patients and probably, I would say, improve adherence as well, without lengthening the patient encounter?
I think that we can do it with only minimally lengthening the encounter. And I think there's a couple ways to do it. One way to do it would be to have some written information. Now, of course, in the survey, half the patients said they got no information. Well, that's patient reported, and we know sometimes that is not correct. But we can have brief written information. Either we create it ourselves, or we can get it from a glaucoma foundation, and just give that to the patient. Two, while they're dialing, many practices have video in their waiting rooms. They can have a video of drop installation while they're dilating. They can actually see it. And the third way is to develop your own technique that you can actually, at the chair side, take a bottle of artificial tears and actually demonstrate it on yourself to the patient. I've asked patients to demonstrate how they do it for me, and they are often very, very poor. They miss, they have bad technique. And I have a technique that I show them how to do with an artificial tear, just right there, chair side, it only takes a few moments, and they seem to really appreciate that. So I think we do take for granted that everybody just universally knows how to put an eye drop in their eye. And frankly, some of our older patients do not.
So what would you say if you had to distill it down to one key takeaway point from this study? What would that be?
Ask patients if they've ever instilled eye drops in their eye and if they feel comfortable doing it. And if they don't feel comfortable doing it, don't be afraid to demonstrate it on yourself. You don't have to give them the bottle to show that show you that they can do it. You can demonstrate for them. It's probably more than they're getting right now.
Excellent. Joe, thanks so much for talking with me today.
Always a pleasure.
And a special thanks to CooperVision for their educational grant to make it all happen.